Hello, everybody. Pilot Newland from Mountain Pacific up here in Alaska. Thank you for joining us today for our It's Worth a Shot. Today, we're going to be covering immunization updates and some updated resources that we're going to share with you from Mountain Pacific. We can go to the next slide. So we always have this disclaimer. If we have outside presenters, we're not necessarily soliciting services from one provider versus another. Today we have two Mountain Pacific staff presenting to you, myself and my colleague, Callie Perkins. We can go to the next slide. So just a reminder about Global Hand Washing Day, which is October 15th, something you might want to promote in your facilities. We've got some resources here that you could use, some training, and just kind of a CDC campaign called Life is Better with Clean Hands. And we will share those links in the chat for folks if they want to celebrate, I guess, this day at their facility. Let's go to the next slide. So Callie's actually going to talk a little bit more in detail about the updates with the up-to-date definitions for the COVID vaccine this fall. But this is the long-term care respiratory pathogens module link. If folks haven't already accessed that, I'll provide that to you. And like I said, Callie's going to talk a little bit more in depth about those definitions in her portion of the presentation. We can go to the next slide. So these are some updated resources that Mountain Pacific has put out this fall. They are patient-focused resources. Kind of a couple of them were kind of fun. We did a Halloween-themed flyer and a football-themed flyer, just with information about the vaccines, mythbusters, frequently asked questions. And then the diabetes and adult vaccines is a resource that is specific to our patients living with diabetes, and then a top 10 COVID-19 questions. Go to the next slide. So as always, please send us your topics that you may want us to present on in the future, and kindly fill out our reviews after our call so we can get you the best information. And I think we have a polling question now. All right, so has your facility reviewed the NHSN long-term care facility respiratory pathogens module, which we just mentioned earlier? So it's looking good so far. The majority of folks, it looks like they have. We'll let the poll run for a little bit here. All right, it's looking like the majority of folks have already done that. So that's good news. We can close the poll, Mary, thank you. And we can go to the next slide. So this is our weekly influenza snapshot. At this point, we're not seeing a lot of flu activity, but as we know, flu season will be kicking off here soon. And so we will continue to report out as we move into the respiratory virus season. We can go to the next slide. So we've seen COVID-19 is actually going down. Previously, we kind of had this late summer spike, but it looks like we're trending down as of this week. We can go to the next slide. So I'm going to talk just briefly about the different vaccines that are available this fall for respiratory season. We can go to the next slide. So the first vaccine and disease that I'm going to talk about is respiratory syncytial virus, which is RSV, more commonly known as. This is a respiratory illness that primarily affects our older population and our very young population. And we're excited to have a vaccine that came out, I don't know how long it's been on the market, maybe a year and a half. And so I'm just going to talk briefly about the folks that should receive that vaccine. You can go to the next slide. So the CDC originally, when they approved these vaccines, they said everybody 60 and older needed to get the vaccine. But then when the ACIP met in July, they changed the recommendation and said that everybody 75 years and older should receive this vaccine. And then for a population of 60 through 74, we would only need to vaccinate our higher risk individuals. So we'll see that on the next slide. These are going to be folks that have chronic diseases, definitely residents of nursing homes, long-term care facilities, folks with COPD, diabetes, anything that makes them immunocompromised. And then even adding in, if a provider thinks that there are other reasons that are not listed here, that a patient might be a candidate to get it in that 60 to 75 age range, they can make that decision based on their specific patient and their risk factors. We can go to the next slide. So I'm actually going to play this video. It's a 2-minute video that I think would be really nice to share with folks. If you have like any common area where maybe you could run the video, it just talks about the people that are at highest risk for getting RSV. Okay, and I'm going to make sure I can share my sound. Okay.
What do these people all have in common? They are all at risk for complications from respiratory syncytial virus, or RSV. RSV can impact people of all ages. RSV is the leading cause of hospitalization among infants and is estimated to kill thousands of older adults in the US each year. Symptoms are similar to cold and flu, but complications can lead to hospitalization and death. Learn how to help prevent RSV at www.nfid.org/RSV.
Okay. So I think Callie will put the link in the chat for that if you folks might want to share that with family members, staff. Uh-oh. It is playing a video after that one. Let me get that turned off. Sorry about that. YouTube thought it was going to play us another video, I guess. So I will say, just going back to this.
Sorry, we couldn't hear it, Kyla, so you were good.
Oh, you couldn't hear it. Okay, so
Right.
I was just hearing it.
Yeah.
All right. So I will mention there are 3 RSV vaccines on the market, Arexvy, Abrysvo, and there's a new mRNA RSV vaccine. It is called mRESVIA. And I'm not sure how widely folks are using that vaccine yet because it is the most recently approved vaccine. So moving on to influenza. Influenza, we know, is a significant cause of illness and deaths annually. This is numbers from the World Health Organization in 2023. So we can go to the next slide. So really, there aren't any changes, significant changes from the recommendations in the previous years. Everybody 6 months and older should get a flu vaccine. And we have multiple flu vaccines on the market. All of them are trivalent, so they're going to cover 3 strains of the flu. And I will highlight those on the next slide. So as in previous years, the CDC also put out a recommendation that patients 65 and older should preferentially get a either high dose, Fluzone high dose vaccine or Fluad, which is another vaccine that's been shown to be more effective in patients 65 and older. So if you do have those products, you should preferentially give to that age group. If you don't, you should just go ahead and vaccinate with whatever vaccine that you do have. but I think most folks do try to carry that higher dose vaccine so they can better protect those older individuals. We can go to the next slide. So as everybody is probably well aware, the CDC is also recommending our updated COVID-19 vaccine for everybody 6 months and older this fall. We have 3 vaccines on the market currently. We have 2 mRNA vaccines. They are monovalent, and we have 1 protein subunit vaccine, which is going to be Novavax. We can go to the next slide. So this is just a report that came out from AARP, and what they saw is kind of this late summer spike, which we saw last year in COVID. But what was alarming is that there was quite a few more deaths this year, and there was also half as many people vaccinated. So we're seeing that correlation between last year, 1 of every 28 residents tested positive, this year, 1 in 47, and the vaccination rates last year being 62% and this year being 31%. So definitely some statistics that kind of highlight the fact that less vaccines is obviously causing more illness, or less vaccinated individuals. We can go to the next slide. So pneumonia, we know this is another fall disease. It is actually caused by bacteria, but we do have a vaccine, multiple vaccines actually for pneumonia. So it's very important that we get our folks their pneumonia vaccines as well. And we can go to the next slide. The only change to the recommendations this fall were that there was a new product added available on the market, which is PCV21, which is brand name Capvaxive. And this is approved for patients 19 age and older. It is another option to give to our patients. If you'll remember, prior PCV20 was the one that was recommended, and they do not cover the same. It's not like there's one additional strain. There's a different mix of strains that each one of these vaccine covers. So just another option. We can go to the next slide. This is a nice chart that kind of can help you identify which disease or virus a patient is suffering from based on the symptoms and kind of the level of their symptoms. And I thought it was a nice visual that you might find helpful. We can go to the next slide. And on this slide, just to highlight that if we look at hospitalization and death from COVID compared to RSV and flu, we are still seeing a much higher percentage. So it's, it's still is higher than those other viruses and diseases. So just making sure that we don't think, oh, it's just like the common cold. It actually is causing more adverse outcomes. We can go to the next slide. Just briefly mentioning bird flu. So since 1997, we've seen 919 human cases, but we've seen kind of a rise here in the last 6 months. And this is a virus that's very similar in symptoms to all of our other viruses. Prior, it was in poultry and our cattle, dairy cows. But we have seen some human cases here recently, which we'll look at on the next slide. So we've seen 14 or 15 cases. I couldn't quite get a read from the CDC website. There was a little bit of a discrepancy, but the most recent one that we saw was actually in Missouri, and there was no identified exposure to animals. And so there is the potential that this could be kind of our first human-to-human transmission. So just to know that bird flu can be treated with Tamiflu or oseltamivir, and we do have vaccine readily kind of available to push out if needed. for folks that might be at higher risk, but really it's those folks that are working in those industries right now that need to be more concerned about it, and not a huge concern for the general population. And that is my last slide. I have resources on this slide. That COVID-19 vaccine guidance and clinic support tools are really nice. Just overview of all the COVID-19 vaccines, the administration, just kind of everything, very detailed. And that's from immunize.org. We have a guide from PharAmerica. It's their flu guide for this year. And then a link to a webinar that talks about the fall and respiratory virus season. And that came out from the American Medical Association. It was a really good call. So that's the link to the recording. And I will turn it over to Callie, unless there's any questions.
Kyla,
Oh.
there was a comment in the chat. If you want to address that. Anna.
Yes.
Okay.
Yeah, so patients would not be indicated to get both PCV20 and PCV21. It would be choosing one or the other, if I didn't make that clear. Does that clarify? Okay.
All right.
Sorry if I made that confusing.
No,
All
thanks.
right, Callie, take it away.
No, you're good. Thank you for clarifying that. And thank you guys for your questions. So last week during our It's Worth a Shot, we asked a polling question about respiratory season and what strategies each of you guys are taking to protect your residents against respiratory viruses. And the number one selected choice was increased vaccination efforts for both influenza and COVID-19. And so that's part of the reason that we wanted to speak on vaccines and vaccine administration today, just to make sure you guys are prepared for that. So let's go ahead and go to the next slide. And I wanted to just kind of quickly touch on this and just make sure you guys have reviewed the NHSN training that came out. It came out last week, and they are doing some replays. So just make sure you guys tune into that if you have not watched it. It looks like from our polling question today, a good majority of you guys have. But just know NHSN reporting tends to continue to be one of the most cited deficiencies. Reporting for our nursing homes is still required weekly, so we want to make sure that we're getting that in. And then essentially from September 30th, if your residents have not received the updated 2024-2025 vaccine, then you should be reporting 0. So you want to make sure that you guys are reviewing your data entries in NHSN and making sure that your reporting is accurate. And I have taken just a screenshot of the slide deck, and I'll put the link in the chat for that, so you guys have the full slide deck. But here's the little algorithm. So if they haven't had the 2023-2024 dose within the past 2 months, or if they have not received the 2024-2025 dose, then they are not up to date. So again, we should be reporting 0 as of September 30th. So make note of that. Today, let's go ahead and go on to the next slide. And for those of you guys that use our Mountain Pacific consent forms, we just wanted to let you guys know that we have updated those forms, and we're going to cover that today. And really the idea behind these consent forms is to help streamline the processes for obtaining consents. I know in talking to you guys, getting access to vaccines tends to be an issue, but also just getting those consents, having the conversations with residents and family members, and then making sure you're getting all of the required documentation. So we really do want to simplify the processes for you guys. So it is a 2-part process. So we're going to talk about the intake and annual consent form first. So let's go ahead and go on to the next slide. So this form is for the resident or the legal representative to determine which vaccines they would like the resident to receive. You'll note that we have added RSV and Tdap on there. Last year we had our respiratory viruses covered, and then with the addition of the RSV, now. So there is a spot for other in there. So when you guys get the full consent forms, and we have the link in the resources, so you guys will be able to see the updated links, and they are available on our website now. The top section there is for which ones they are accepting based upon eligibility. So they may accept, like, yes, I would love to have a shingles vaccine, but that doesn't necessarily mean that they're eligible. But they can go ahead and check off that they want to accept the shingles vaccine or the RSV or Tdap. And then once it actually comes to administration time, we're still going to ensure that the resident is eligible for that vaccine before they actually receive it. And then the second part here is vaccines offered and declined. So you've offered them influenza, pneumonia, and they'll check off which ones they do not want to receive. When we're meeting with our resident and or their legal representative, you want to make sure that you're providing that education, you're reviewing which vaccines they're eligible for so you can let them know which ones they're eligible for at this time, and then also provide that education, like go ahead and sign off which ones you want them to have, but that doesn't necessarily mean that they're going to receive it. So it's just the ones that we will only give them what they're going to be eligible for when they are eligible. So let's go ahead and go to the next slide. So the second part of this first form is the acceptance and declination. So there's two separate sections. One is saying that they're authorizing the healthcare provider to administer those vaccines, the ones that they've said that they've accepted. And then the second part in the box is that they are acknowledging that they've received the education, that they know the risks associated with the actual infection, and that they are releasing the facility and provider of all responsibilities and damages. Again, this is a great time to address misinformation, provide those VIS sheets and the benefits of vaccination and those potential risks. You want to make sure that they are adequately educated. Let's go ahead and go to the next slide. So this is the second part. So you've received the consent form, you have the vaccine intake and annual consent. And again, that is an annual consent. So you can keep it on file for that full year. And then once you actually go to administer the vaccines, you are going to do the eligibility assessment at the time of administration. Let's go to the next slide. So you're going to acknowledge, acknowledge that they've received their VIS sheets, you've done the screening questions, and then confirm the resident and which vaccines they've requested. And so just a quick checkbox on this and initials. And then let's go ahead and go to the next slide. I did just want to touch on this, and it's funny, just in the past week, I've received a couple of questions on this. So the VIS sheets are located on the immunize.org website, and I've taken a screenshot here for you guys so you can see the most current list of the VIS sheets and the information. And I did want to remind you guys that some VISs must be used for certain vaccines. So you guys can see that influenza is one of those. The DTaP is on there, Tdap is on there, pneumonia vaccines are on there. So you want to make sure that you guys are providing the most current VIS sheet to your residents. So if there's any that have changed in the past year, you'll want to make sure that you have that updated VIS to provide to the resident and or their legal representative. They are available in dozens of languages, so you want to make sure that you're prepared to give the resident their VIS in the corresponding language, their primary language. So again, take a look at that. It's available Spanish, Chinese, Portuguese. So make sure you guys are pulling the correct one. And that way you can meet people where they're at. These VIS sheets, the screenshot that I've taken, you can actually print it right off of the link that I've dropped into the slide. And they come in little like quarter page sizes. So you can just put it in on all of your med carts or your vaccine fridges. So that way you can remember which VIS you should be pulling. You just want to make sure that you guys update those. And I do pay attention to those as VISs come out. If there's any changes, I try to make sure that I get those sent out to you guys as well. Let's go ahead and go to the next slide. So this is the actual documentation. There are specific things that are required for documenting vaccines that you administer to your patients or residents. So you want to make sure that you're capturing the vaccine manufacturer, the lot number of the vaccine, the date the vaccine is administered. We have the location, so left arm, right arm. And then when you guys sign off, you'll make sure you want to capture the immunizer. So if for some reason you're administering, say you have influenza and COVID administrations at the same time, but it's two different immunizers, you want to make sure that each one of them is filling out their section if they receive them on the same day. Now, this sheet is only good for that one day. So the vaccine administration and eligibility questionnaire is only good for that vaccine clinic. So say you have influenza and COVID vaccines provided today on 10/2, you'll need to do a separate vaccine administration and eligibility questionnaire for the next time they have a vaccine. You don't go in and add this because you want to be able to show that you've done the screening questionnaire for your resident on the day of administration. So you'll have to go over that section all over again. So again, just to reiterate, the vaccine intake and annual consent is good for a year. The vaccine administration and eligibility questionnaire is only good for the day of administration. So because you're doing that real-time assessment of your resident's condition. Do you guys have any questions on that? Okay, let's go ahead and go to the next slide. And here are the links to the standing consent forms and then the eligibility form. I've dropped the link for the VIS statements and also for the other languages. And then I just wanted to add, there was some communication or a link to the communicating the benefits of influenza vaccine. I just thought that that was a really great resource. I know that's something that is always a challenge, is providing that education. I'm just trying to keep up with the chat. Are there any questions? Okay, any word on the COVID VIS getting updated? No, I have not seen anything on that. Anna, I will definitely continue to keep an eye on that and let you know as soon as that is out. But I have been watching for the 2024-2025. VIS needs to be given to patient, resident, and caregiver. It is federal law. Yes, thank you, Denise. I thank you for reiterating that. I agree. I don't know if someone already posted this, but the CDC has a helpful app for determining if someone is eligible for the pneumonia vaccine. Yes, great point, Pamela. I refer people to that frequently. I love the app. It's easy to use. If you don't download the app to your phone, there is a desktop version. So it walks you through a couple of questions and helps guide whether or not somebody is eligible for the pneumonia vaccine. And yes, I would be happy to drop all of the links to the forums in the chat right now. Can get that done before you guys hop off. And then let's go ahead and go to the next slide. And please take a moment to fill out the evaluation, stay on, and I will drop the links to all of the vaccine resources in the chat real quick for you guys. And then join us next week. I am going to be presenting. We have another resource that's updated and we're happy to roll that out. We are going to be talking about the infection prevention guide and checklist. And then we will have a guest speaker, Kelly O'Leary. She is going to talk on the components of a good IP program. So make sure you guys join us for that. And then again, stay on for just a moment and I'm dropping the links in the chat right now for all of the different forms. And thank you guys for joining us today, as always. And one more. Okay, last one. Thank you, everyone.
Bye, everybody.